This segment is sponsored by Ohio Opioid Education Alliance.
The Columbus Department of Health has undoubtedly been very busy right now during the pandemic, especially their director, Health Commissioner Dr. Myshika Roberts, who joins us today. I can imagine you have been busy.
Yes, we have been busy, and I've been busy too.
Wow, so talk about how COVID-19, this pandemic, has affected people dealing with mental health and addictions.
Yeah, thank you. So this pandemic has been very stressful for all, but especially those living with the disease of substance use disorder. The uncertainty, the unknown, the job loss, the economic stress can really put an additional level of pressure on all of us. But those dealing with the disease of substance use disorder and mental health issues, it's been even more trying for them.
Absolutely, and I know before this whole pandemic, you had a plan in place and goals to help fight this opioid addiction. How has the pandemic affected those plans and that schedule?
Well, we're still working with our partners.
Okay.
We still meet regularly. We're still trying to achieve those goals, and we're still working towards those goals of reducing the number of overdoses, reducing the number of overdose deaths, and reducing the spread of infectious disease. But as a result of the pandemic, we're also looking at some short-term interventions we can do to help those dealing with substance use disorder, like mail order Narcan, like pop-up Narcan stations, as well as our week of walk-in on Wednesdays. We do walk-in Wednesdays where we go to different community sites and provide all the services we think individuals who are dealing with disease of substance disorder that they can access.
And you mentioned, Dr. Roberts, Narcan. How effective has that been?
Well, Narcan is very effective when it is given to someone who's experiencing an overdose. That's why it's so important, and we tell people not to use alone. Make sure you use with a friend or someone who can be there to administer Narcan if you need it. And that's what we found in many, during this period of isolation. Many individuals are alone because of the social distancing, and they don't have someone there to administer Narcan to them. But we're trying to get Narcan in the hands of as many people as possible so that that can be readily available for those who are dealing with the disease of addiction.
That is great, and it hits so close to home here in Central Ohio. I know a lot of people watching probably know someone dealing with an addiction or some type of mental health. What advice do you have for them to help make an impact?
Well, even during this period of social distancing and isolation, we encourage people to reach out, and don't just reach out by text. Sometimes do a FaceTime, sometimes do a call just to see how people are doing. Make sure they know someone cares about them and someone loves them. And when at all possible, try to arrange some time where you can be together. Again, social distance, but at least check in on someone to see how they're doing, whether by phone, by text, or even just in person, just to see them face to face.
It's so important. And is there a website, Dr. Roberts, people can go to find out all the information you just shared and more?
Absolutely. Go to columbus.gov/CFCAP, Columbus and Franklin County Addiction Plan.
Great. This information has been great. Dr. Roberts, thank you so much for sharing it with us today.
Thanks for having me.
And as she said, it's so important. If you know someone struggling with mental health or addictions, reach out to them, make that connection, and visit the website to make an impact today.